All right, today we're going to do something pretty incredible. We're going on a journey deep inside the human body, but we're leaving the scalpel behind. We're going to break down the complex world of endovascular surgery into a story about this amazing, minimally invasive adventure that is absolutely changing modern medicine. So let's get started. To really get why this is such a huge deal, you have to see the before and after. On one side, you've got traditional open surgery. We're talking large incisions, general anesthesia, long and painful recoveries. But on the other side, that's what we're talking about today, the endovascular approach. It all starts with a tiny puncture, sometimes no bigger than the tip of a pencil, and it promises a much faster, less traumatic way to heal. And this really is a whole new era of surgery. This isn't some niche experimental technique anymore. Endovascular therapy is now the go-to treatment for a massive range of vascular diseases. It's a fundamental shift in how doctors fix problems inside our blood vessels. And it all begins in a really surprising way. Right here, this is it. This is where the entire journey begins. So forget what you might picture when you think of an operating room. This unbelievably high-tech procedure, it all hinges on one single thing: getting access to the body's vascular superhighway through one perfectly placed entry point. But think about it. Where do you even make that puncture? The body has literally miles of blood vessels. So the first and maybe the most critical decision a surgeon has to make is picking that perfect on-ramp into this super intricate network. So how do they choose? Well, it's not random. It's a huge strategic decision. They're asking themselves, is this vessel big enough for the tools I need to use? Can I easily stop the bleeding when I'm all done? Is it in a safe spot where if something goes wrong, I can quickly convert to an open surgery? And maybe most importantly, will using this vessel cut off blood flow to anything important downstream? It's a whole checklist they run through before a single tool is even picked up. And more often than not, the answer to all of those questions points to one specific spot: the common femoral artery, right in the groin. You can really think of it as the main entrance ramp to the body's entire vascular highway system. From there, you can get just about anywhere. So why there? Well, this is the really cool part. It comes down to some brilliant, simple anatomy. That artery sits right on top of the femoral head. That's the ball of your hip joint. This gives surgeons a hard, bony surface to press against, which makes it incredibly easy to apply manual pressure and stop the bleeding safely after the procedure's over. It's like a built-in safety feature, courtesy of the human body. Okay, so the path is chosen. Now you need the right gear. And we're not talking about a simple needle and thread here. This is a highly specialized toolkit, like something out of a sci-fi movie, designed for navigating the delicate, branching roads of our circulatory system. And to get a handle on the toolkit, you kind of have to learn the language of size. And honestly, it can be a little confusing. Sheaths and catheters, they're measured in a unit called French. Needles are measured in gauge, where a higher number means a smaller needle. And then the guide wires are measured in plain old inches. Each part of the kit has its own system, all for the sake of ultimate precision. But to put it all into perspective, let's talk about just how small these tools are. A super common sheath size is 6 French. And what does that mean? It's just 2 millimeters wide. That's it. A tiny little portal that lets doctors perform major life-saving procedures. So the very first tool to go in is the guide wire. The best way to think of it is as the advanced scout. It's this super thin, really flexible wire that carefully snakes its way through the vessel first, basically creating a safe, reliable track for all the bigger tools that are going to follow it. Okay, the scout is in. Next up is the sheath. If the guide wire is the scout, the sheath is like the secure portal or the docking station. It's a short, hollow tube that slides right over that guide wire. And its job is absolutely critical. It holds the artery open and provides a stable port, so the surgeon can swap out different tools safely without ever losing access or damaging the vessel. And finally, we get to the catheter. This is the main delivery vehicle, the real workhorse of the whole operation. It follows the path laid down by the guide wire, and this is the tool the surgeon uses to do the actual job, whether that's injecting dye to see what's going on, delivering a stent to prop open a vessel, or performing whatever treatment is needed, deep inside the body. So let's put it all together. It's this really elegant process called the micropuncture technique. It starts with a tiny needle making the first puncture. Through that needle, an even tinier guide wire is slipped in. Then, the needle comes out, and a small starter sheath goes in. After that, they swap the tiny wire for a bigger, more robust workhorse wire. And finally, that small sheath is exchanged for the final, larger working sheath. It's just a beautiful, step-by-step dance of safely scaling up access. Okay, we've got our access, we've got our tools. Now the real journey begins. Navigating the incredibly complex twists and turns of the body's highways to get to exactly where they need to be. And just like you'd pick a different car for a different kind of road, catheters are shaped for the anatomy they're about to face. If you've got a gentle curve, like a vessel branching off at a nice, easy angle, a simple single curve catheter is all you need to make that turn. But what if you have to make a sharp 90-degree turn? Think about the arteries that branch right off the aorta to go to the kidneys. For that, you need a more specialized tool. You need a double curve catheter that's designed with a much sharper angle so it can hook right into that opening and nail the corner. And then you have the most challenging move of all, a complete U-turn. How do you get from the leg all the way up and then back down into the carotid arteries that go to the brain? For that, surgeons use this incredible piece of engineering called a reverse curve catheter. It's designed to literally loop back on itself inside the aorta so it can point upwards and navigate that incredibly steep angle. Just amazing. Now, as incredible as all this technology is, we have to be realistic. It's not without risk. Even these minimally invasive procedures can have complications. And guess what? The vast majority of them happen right back where we started, at that access site. As you can see here, the most common issues are things like hematomas, which is basically significant bruising, or something called a pseudoaneurysm, which is like a blister on the side of the artery. And it makes sense, right? The access site is the one and only place where the body's sealed vascular system is breached from the outside. Now, most of these are totally manageable, but it just goes to show how critical that very first step really is. So how do we make that critical step even safer? Well, technology has the answer, and using ultrasound is an absolute game changer. Think of it like a GPS for the needle. It turns what used to be a blind puncture into a precision-guided maneuver. The surgeon can literally see the needle, the artery, and everything around it in real time. This lets them guide that needle tip right into the center of the vessel, avoiding nerves and making sure they don't poke through the back wall. And that really is what this all comes down to. A successful endovascular journey isn't just about the amazing tech. It's about the fusion of that incredible technology with profound human skill and judgment. When you boil it all down, it's a complete system. It starts with that strategic choice of where to go in. It demands a mastery of the entire toolkit, the wires, the sheaths, the catheters. It relies on imaging to see the way. And it all wraps up with that critical final step, achieving safe hemostasis, or stopping the bleeding and closing the door after a successful mission. So from a single, tiny puncture, surgeons can now travel almost anywhere inside our own vascular system. And as these tools get smaller and smarter and more capable, it leaves us with a really fascinating question to think about. What's going to be the next frontier they allow us to explore inside ourselves?